Hello, everyone. Welcome to the Limitations of Norm Reference Tests. I'm joined with Dr. John Hellman from the University of Wisconsin-Milwaukee, who I think will say a few words about himself when we start this section 2. And so I'll just get started right now. And so I'm Andrea Bertoni. I am a speech and language pathologist, and I work for the Department of Public Instruction. And I've worked here for about 3 years. And before that, I worked in a large school district and in Wisconsin and worked directly with kids. Want to give a quick shout out to the Wisconsin Statewide Parent Educator Initiative, or WISPE, for letting us use their Zoom today so we can meet in this way. And part of why we're here today is to talk about the limitations of norm reference test in the context of our new rule, which went into effect on August 1st. And it is on the website. And I had sent you the participant folder prior to meeting today. Also, we had shared, John made a YouTube video, a 9-minute video to get you all excited about everything about norm reference tests. I also shared with you the significant discrepancy document that we put together over the summer that can help guide your thinking on this topic. And once finalized, once we finish recording and captioning this recording, it will go on the speech and language website, which is also where everything except for John's YouTube video will live. Few questions today, put them in the chat. Like I said, we'll try to answer as many as we can. There's also the Jamboard. And this also has a link to future webinars in the series. We're meeting every month this year almost. And if you're looking for anything to read, something to read, Marie Ireland and Barbara Conrad, two colleagues of mine, in 2016 published this Evaluation and Eligibility in the Schools. I think it's a great resource, and it's worth spending some time on if you're looking for a research or a journal article to read. So for today's learning, John and I came up with 4 objectives. We want to make sure that we review the comprehensive assessment model. It's something that you've been familiar with the last couple of years if you've attended any of my professional development. And then John's going to delve into the limitations of norm reference tests, engage in case study work, to think about designing more comprehensive assessments. And then we'll end today with some resources and next steps to further your learning and support. You know, some of what people have asked about, well, does this change in criteria? Is it going to make things more difficult to qualify? Will it be easier to qualify? And I think that that's not quite the right question. And the whole purpose was making sure that we're more up to date and in line with best practice. And we want to ensure more accurate identification. It's not whether or not it's easier or harder to identify or label kids, but it's making sure we're more accurately identifying kids, taking into account their cultural and linguistic backgrounds, and versus just, designing one size fits all kind of evaluation. What is an evaluation for special education? Well, IDEA tells us that evaluation means procedures used to determine whether a child has a disability and the nature and extent of the special education and related services that the child needs. So the purpose of evaluation is twofold. And that when you're planning assessment, no single measure or assessment is used as the sole criterion, right? We all know that we can't just do one thing to qualify a student or to determine eligibility or whether or not they meet criteria for the impairment. And so we've been talking a lot, and I got this from Marie Ireland out of the Virginia Department of Education, that our evaluations should be comprehensive. So we're looking at 4 different domains. We're looking at the norm reference tests, right? Those are pieces of information that we use, but we're balancing it with other speech and language probes that we've been trained on and that we engage with: case histories and interviews, language samples, dynamic assessment we talked about last spring. Also getting academic information from classroom teachers, doing observations, looking at artifacts. And then looking at the contextualized tests that kids take in the schools, like the STAR or the MAP, and curriculum benchmarks. So a comprehensive assessment would look at all 4 domains, and will also appropriately keep the decontextualized test or the norm reference test as just 1/4 of the model. It's just one piece. And there are some limitations, and I'm just going to do a real tiny brief overview or summary, saying that they vary in their accuracy. They assume all children have had the same experiences and opportunities, when in fact we know that's not the case. And that skills evaluated sometimes are associated with culture or socioeconomic status, such as vocabulary, than whether or not a child has a true language impairment. And this is a great resource. Kate Crowley out of the Leaders Project at Columbia University, if you want to look that up further. And some more research does say that there's an over-reliance on formal assessments in identification of speech-language impairment. And that's some recent research. And that test selection is often not dependent on student need or on the psychometric properties of the test. And John is going to get into that. Some other issues with norm reference tests, they don't just address disorder within a dialect. Normative samples can be limited, and educational impact is missing, right? And so determining a disability is not in compliance if they're solely on standardized tests. And in case you needed even more support as to why we need to rethink what we do and how we do it, there's this 2020 article that talks about the very same thing, about having converging evidence. And that, and this is specifically with English learners, and how when you make your decision about eligibility or services for students, you're taking into account all the different information from parents and caregivers, from the standardized assessments, through observations, and through more connected speech and language production. So that all comes together. And when we're thinking about providing, doing more culturally responsive assessments, here are some recommendations. Evaluating the child in both languages unless it's not feasible to do so, using translators to get detailed case histories so that we have better understanding of what's happening in the home language, interviewing school staff about the use of language across school settings, and there's dynamic assessment again that we talked about last spring to think about students' modifiability. So what can you do to make your assessment more culturally relevant? You know, it's just like what I said, asking questions about the whole child, really thinking about functional performance and adding standardized assessments if needed. Really think about cultural expectations versus school expectations and how those are different for kids who are culturally linguistically diverse. And when you're thinking about norm referenced assessments, looking at the normative sample and test items for potential bias. And so that was just a brief overview. All of this is information that I've shared before, and it just lays the foundation as to why we're going to dig deeper on this issue with limitations of norm reference tests. So John, take it away.
All right, I'll take it away. So hopefully you see this slide here now that says John's disclosures. If you don't, someone can shout out and let me know. But it's great being here with you all. I'm excited to talk to you about this fascinating topic, this important topic. It was really fun letting people in, seeing lots of names that I recognized, a little intimidating seeing all the names come in, but I hope that I can share something interesting and meaningful with you today. So my research area, what I think about most of the day are different types of descriptive assessments. When we think about these descriptive assessments, such as language sample analysis, dynamic assessments, often we think about them in place or as an alternative to a norm reference test, right? So I don't want you to just think that I don't think norm reference tests have any place and that they're of no use. I do believe that norm reference tests do have a time and a place in the comprehensive assessment. So that's what I want to get through today, right? So my plan for today is just to do a quick overview to make sure we're all on the same page when I say the word norm reference test, I'm going to identify 4 major limitations. So I'm going to organize this based on 4 major limitations. I'll talk about some biases that we can often see in our norm reference test. I'll talk about the psychometric properties of norm reference test. I'll talk about how they're used with diagnostic decision making. And then finally, talking about the role or lack thereof of assessing functional communication. As we go through, I'm going to try my best to not get too fast and excited, because this is a topic that I really get passionate about. So I have a lot to get through, but I'm going to get through it in a way that hopefully is that you can follow. If you do have questions, put them in the chat. I loved seeing the questions, the questions that were in the Jamboard. We're not going to get a chance to answer all of these, but I would like to see your questions. And then even after, if I don't get a chance to answer your questions directly, find some way to share the information with you. Okay, so let's get down to it. So, often we'll hear lots of different terms. You'll hear terms thrown out like norm reference test, standardized test, formal test, decontextualized test. Well, what is it that we're talking about? Well, when we talk about a standardized test, we're talking about things that are uniform and consistent. Every student gets the same direction. Every student completes the same items. Our scoring rules are the same. The pictures that we use as prompts are the same, right? So it's a very standardized administration. Now, the norm reference part of that is where we compare your performance on that test to a group of your peers, right? And the main feature of a norm reference test is that you're able to rank order a group of peers, or you're able to rank order an individual compared to their peers. So this is where we get percentiles and standard scores and things like that. And this is going to be a recurring theme, that these tests are designed to rank order individuals, right? And I like this little, phrase to think about this, that all norm reference tests are standardized. If we're going to be comparing to your norms, everyone has to have completed the same task. However, all standardized tests aren't necessarily norm referenced, right? So I can think of, when I was going through this morning, one that came to mind was the Rossetti. You ask the same questions and complete all the same items. But you're really looking at whether they're meeting a certain criterion is not, as opposed to getting a standard score and a percentile and seeing that rank order. So I love giving norm reference tests. I always like teaching about them and talking about them. The standardized administration, it promotes consistency. We get, when we administer them the same way. We know them, we know what to expect. And really what we're going for here is this term reliability. And then they're also really nice, and note that I have in big air quotes, we can objectively quantify a student's performance, right? Now I'm going to talk about how that might not be so objective as we think it is, but we can get some sort of number. We can get some sort of a way to quantify the student's performance, show their relative standing. So as we move forward, now, that was just my quick overview. So we're all on the same page of what a norm reference test is. As we move forward, I'm going to talk about several limitations of these norm reference tests. But again, I don't want to lose sight of where these tests can contribute within that comprehensive assessment model.